We have long recognized that we must shift our healthcare systems toward preventing disease rather than just on-site care. Societies around the world are facing an aging population, rise in chronic and preventable disease conditions, rise in healthcare costs, and in some high-income countries, we see poor health outcomes despite high levels of investment. The shift to prevention requires practical, evidence-based solutions and policies taken to scale and embedded in communities. This will take all stakeholders working together in partnership. We're at a critical moment in accelerating this shift, and that is why the Milken Institute established Project Prevent. We're bringing together the health ecosystem to catalyze partnerships and scale solutions to enable supportive policies.
As a primary care provider, I've actually seen the impact of chronic disease and cancers on the lives of my patients. And I always think to myself as a PCP, how much more could we do for folks if we were actually helping them to get upstream of those chronic diseases?
Prevention is at the heart of getting ahead of disease together. Advances in science and technology have placed us in a better position than ever to get ahead of diseases. The innovation in vaccines and medicines has revitalized the value and the investment case for prevention and earlier intervention. At GSK, we are also innovating how we collaborate with health systems to deliver on the triple aim, improving care and outcomes while reducing costs. We're bringing our portfolio and we're bringing data, resources and expertise to co-create multi-year initiatives that are tailored to unique patient populations. This work is also being pulled into Project Prevent and will inform future pilot designs.
65% of Americans are behind on their cancer screening. And in fact, by our own research here at the American Cancer Society, we project that if patients could just have access to the prevention and early detection mechanisms that we know about right now, no innovation required, we could reduce the cancer mortality rate by another 30 to 50%. These are not small numbers.
I see the world through the eyes of data. And that is the data of the past can help us build care journeys and wellness for the patients of the future. I think wellness brought to the community has to start with capture of data from that community, empowering local innovators to make change.
We had excellent data. So we had a very clear picture of how the pandemic was moving in our city. We used a lot of old technology to do that, so we had to really build that back in a more 21st century way after the pandemic started to wane, and so we launched a Center for Population Health, Data Analytics, Data Science. But none of it would have worked without community engagement.
If you know anything about patients in the underserved community, if they don't have access to healthcare and they're getting in front of a physician for the first time in 6 months or a year, they have a lot to talk about, right? Our case managers take care of that. Yes, concierge care that we provide on our mobile clinics. These communities have never seen this type of care. They've never seen anyone bring care to them versus them have to go into care.
I heard someone say, healthcare doesn't happen in the doctor's office. It happens where you pray, where you work, where you shop, etc. And that really resonated with me because there were so many elements of my life that impacted my healthcare and would serve as preventative measures had they been addressed soon enough.
And this can only be achieved through partnership and collaboration. We hope you will join us.